Hi, this is Becky Oberg with the Than Borderline blog at healthyplace.com. Today I'm going to be talking about schema therapy and its concept of maladaptive schemas. Schemas are how you see yourself. Therefore, an early maladaptive schema is a view formed in childhood that I am somehow defective. Now, these schemas are divided into 5 different domains: disconnection and rejection, impaired autonomy and performance, impaired limits, other directedness, and overvigilance and inhibition. They're all what happens when the basic emotional needs of a child are unmet. Under disconnection and rejection, we have a few more schemas. There is an abandonment and instability schema, which is a belief I'm on my own. There is a mistrust abuse schema, belief that the world is out to get me, to hurt me. There is an emotional deprivation issue. That can be further categorized into 3 subtypes: no nurturance, or a belief that no one loves me, no empathy, or no one understands me, and no protection, or no one will help me. Another schema under the disconnection and rejection domain is defectiveness and shame, the belief I'm no good. And finally, there's the social isolation and alienation, or I'm alone in the world and don't fit in anywhere. I'm not part of any group. Another domain is impaired autonomy and performance. Those are expectations that interfere with your survival. Under that are dependence and competence, aka I can't do anything right without fill in the blank. Vulnerability to harm or illness, which is more than what it sounds. It's a fear that there is an imminent, unavoidable, catastrophic disaster waiting to happen, such as you get on an elevator, the cable breaks, and the 4 emergency brakes fail. After that is an enmeshment or underdeveloped self, aka I can't survive without them. Finally, there is a failure schema. That's belief that I have failed or I will fail. The next domain is impaired limits, and when limits on a person's conduct are not set, 2 schemas can result: entitlement and grandiosity, which is a belief that one is superior and does not need to follow the rules, and insufficient self-control and discipline, which is self-explanatory. Another domain is other directedness, or focus on others at the expense of self. Under this are the schemas of subjugation, which is forced suppression of physical desires or emotions in order to please someone else; self-sacrifice, which is meeting others' needs while your own go unmet. This is often due, according to Dr. Jeffrey Young, the founder of schema therapy, an extreme sensitivity to someone's needs, someone's pain. And finally, there's the approval seeking and recognition seeking, which is a constant overemphasis on success. Finally, the last domain is overvigilance and inhibition. These schemas are negativity and pessimism, emotional inhibition or an inability to show emotions, unrelenting standards or hypercriticalness, or as I like to call it, when perfect isn't good enough, and punitiveness, belief I should be severely punished for my mistakes. These maladaptive schemas are what happens when a child's basic emotional needs go unmet. Tune in for the next video post when I will explain how schema therapy tries to meet these needs and teach people to rethink.